Nurse Ashley, are you the parent of Miss Chick?
What happened to my daughter? No! No, this is not true. I want to know the real cause of her death, Nurse Alcaide. Please help me.
We are very sorry to say this, but your daughter has passed away at exactly 2:07 p.m. The patient has a history of diabetes, anemia, and rectal bleeding. She has a family history of myocardial infarction. We suspect that Miss Chick has a massive clot inside the heart and abscess from the intestine, causing infection to the whole body. We would like to continue to discuss the anatomical position, directional and regional terms, and body planes and section, which are known to be the language of anatomy. Would you like to proceed? Before anything else, I would like to introduce the two interns that would be teaching you the things I said earlier. Here we have Dr. Andre Argente and Dr. Andre Alejandro.
The anatomical position is the body's standard position. In this position, the body is upright with the arms hanging at the sides, palms facing forward, and feet parallel to each other. It is important to know this because it is considered to be the reference point in determining different terminologies about the body.
Next, we have the directional terms wherein a person in the medical field can utilize in order to explain and describe where a specific body structure is in relation to another. We will discuss each of these directional terms as we go along. Connected with this are regional terms, which are visible landmarks on the surface of the body. This includes anterior or ventral, which is the front, and posterior or dorsal, which is the back part of the body.
Lastly, when internal structures or parts of the body are to be examined, sections are to be observed. On the other hand, when that section is made through the body wall or through an organ, it is made along an imaginary line called a plane. Since the body is three-dimensional, three types of planes or sections are evident, namely the sagittal, which divides the body into right and left parts, median, if both right and left parts are equal in size, frontal section, which divides the body or an organ into anterior or front and posterior or back parts, and transverse section, which divides the body or an organ into superior or above and inferior or below parts.
Before we start the autopsy, we need to prepare the proper instruments. We will need a dissecting pan, washcloth or plastic cover, dissecting kit, surgical gloves, safety glasses, some pins and a marker, and of course, our lab gown and apron.
This is the ventral side. It is also called anterior, and it is the front part of the body. As you flip over the patient, this now is called the dorsal side. It is also called posterior, and it is the back part of the body.
We have shown few simple terms that will be needed to understand the positions and the dissection. Are you still willing to participate with our interns as we go along? Great! Our interns will show you how it is done. We hope you understand the things that will be shown, but rest assured that our interns will make it easy for you.
start the autopsy by placing the patient in the anatomical position. As we have mentioned earlier, this is the body's standard position. This is the ventral side. It is also called anterior, and it is the front part of the body. As we flip over the patient, this now is called the dorsal side. It is also called posterior, and it is the back part of the body.
This larynx is superior to the breast.
Superior means toward the head end or upper part of a structure or the body. Let's move on to the proximal. The upper wing is proximal to the wingtip.
Proximal means close to the origin of the body part or point of attachment of a limb to the body trunk.
Now let's move on to distal. The claw is distal to the thigh. At this part, we will need to locate the abdominal region in order for us to fully recognize. Andre will use a marker to divide the abdominopelvic cavity into 9 different regions and quadrants.
Why do we need him to locate it? Since the abdominopelvic cavity is quite large and has many organs, it is divided into 9 different regions or quadrants by a scheme in order to divide it into smaller areas and be able to study its parts with ease. The epigastric region is medial to the wingtips.
The interregion. Basically, it is between a more medial and a more lateral structure. For instance, the left hypochondriac region is intermediate between the epigastric region and the wingtip.
Medial means toward or at the midline of the body. The procedure that we will be doing is cut along the longitudinal plane with the mid-sagittal section from the superior part of the sternal region down to the inferior-most part of the abdominal region using a scalpel.
What is superficial? Superficial means toward or at the body surface. For instance, the skin is superficial to the skeleton of the patient.
So before we examine specific organs, we will be describing first the location or position of the organs using directional terms with reference to other organs.
We can say that the intestine is inferior to the liver.
Next, we can also say that the heart is superior to the liver.
The ovary is posterior to the gizzard.
The lungs is posterior to the heart and attached anteriorly to the posterior chest wall.
The kidney is inferior to the lungs.
The attending told us that there is a massive clot somewhere inside the heart. With that, we will be extracting and examining the heart first. With the use of a scalpel, Andre will execute a frontal section to the heart. The frontal section is a cut along a lengthwise plane that divides the body or an organ into anterior and posterior parts. Now that we have successfully divided the heart into their posterior and anterior parts, we can now distinguish the right and left atrium, the right and left ventricle, mitral valve, tricuspid valve, aortic semilunar valve, pulmonary semilunar valve, myocardium, and endocardium.
The attending also told us that among the few possible causes of the death is the rupture of an abscess from the intestine of the patient, causing infection in the whole body. With that being said, we will now be extracting the intestine. As you can see, there is the presence of feces inside the colon as Andre cut it using a mid-sagittal section.
What remains as waste passes along one's colon and rectum. At times, things may go wrong in this process and the feces is stuck inside the colon. This is known as fecal impaction of the colon, which we believe is what happened to the patient.
As we continue, Andre will have to cut a longitudinal section to examine the stretch of the patient's wall to locate the origin of the infection. And again, there are feces inside.
Now that the autopsy is performed, it can be concluded that the patient died shortly after a heart attack. This is also known as myocardial infarction, which is the damaging or death of an area of a heart muscle resulting from a blocked blood supply to that area.
The main causes of myocardial infarction are first, atherosclerosis, also known as coronary artery disease, which occurs when the buildup of fat, cholesterol, and other substances forms plaque on the walls of the coronary arteries.
Coronary artery spasm, a rare cause of blockage spasms of the coronary arteries, can cause them to become temporarily constricted. This constriction can block blood flow to the heart and cause heart attack if it lasts long enough.
Fecal impaction is the hard, large mass of stool that gets stuck in one's colon or rectum that cannot be pushed out. This can be very severe, from illness to even death, which happened to the patient. We believe that this autopsy has done a great service to the patient's family.